The focus and the mission of Bright Spots in Healthcare was born out of a book I read called Switch by Chip and Dan Heath. And I read it over 10 years ago. And in that book, there's an anecdote about a guy by the name of Jerry Sternin. He's with a non-for-profit called Save the Children. And in 1990, he's asked to go to Vietnam to solve the epidemic of malnutrition in kids. So think about where you were in 1990, what you're doing, what technology you had access to. He lands there with his wife and one coworker, no resources, and is quickly told by the foreign ministry he's not welcome. His green card's only good for 6 months. And, oh, by the way, we have generations of poverty in this country. We have poor access to clean water. We have a sanitation problem countrywide, and most of our people live in rural areas where there is low or no education, and there's not really a desire to change that. And so if you could solve those 4 problems, you're going to be able to solve this epidemic. And what Jerry did was simply bring mothers together and ask mothers in a village if they could help identify healthy kids. And they did. Traditionally, kids were fed the highest quality rice in a soft dishes in ways that were very appetizing to a young person's palate at the time. And what these mothers were doing differently, they were mixing in crabs and shrimp and sweet potato greens into the rice dishes to hide the taste, but bring in important nutrients into their meals. So Jerry quickly realized there was a blueprint to how to solve this epidemic. But he also knew that knowledge doesn't change human behavior. So what he did was he brought mothers together in the village to have fun social gatherings and have sort of their peers teach their other peers, teach their neighbors how to cook these dishes, where to find the crabs and the shrimp within the villages. Once their friends saw how easy it was and the impact it could make on their families, they started doing it, and they taught their neighbors on what they were doing. He stayed for another 18 months, 2 years in total. He touched 2.2 million children in the country, reduced malnutrition in the country by like 20% in just 2 years, just bringing peers together to take bright spots and clone it. And I'm like, this is healthcare. This is healthcare in our country. And what if we could find, things that are working in our field of view, identify them, understand them more, and that would solve, a big problem as far as a strategy, and that is allowing leaders to understand exactly what needs to be done differently. And so the mission of our show is to bring plans and providers and tech and solution providers together to share bright spots that are happening in different pockets of this land on the hope that it changes the line of thinking and or allows our audience to actually clone these ideas. That is the quickest way, I believe, to improving healthcare in our lifetime. We couldn't call the show Positive Deviance in Healthcare because that's exactly what it is. It's the science of positive deviance and how to leverage that. So we called it Bright Spots in Healthcare. And what we try to do every episode is bring mothers together to teach other mothers in the village how they create dishes in the hope that the mothers in the audience pay attention and learn those recipes and cook those dishes for their families.